Leukemia. Leukemia is malignancy of the body's blood-shaping tissues, including the bone marrow and the lymphatic framework. Numerous sorts of leukemia exist. A few types of leukemia are more normal in youngsters. Different types of leukemia happen generally in grown-ups. Leukemia as a rule includes the white platelets. Your white platelets are powerful disease warriors. They regularly develop and partition in an organized manner, as your body needs them. In any case, in individuals with leukemia, the bone marrow delivers an unreasonable measure of strange white platelets, which don't work as expected. Treatment for leukemia can be intricate, relying upon the sort of leukemia and different components. In any case, there are techniques and assets that can help make your treatment fruitful. Side effects. Leukemia side effects fluctuate, contingent upon the kind of leukemia. Basic leukemia signs and indications include fever or chills, constant exhaustion, shortcoming, successive or serious contaminations, getting thinner easily, swollen lymph hubs, amplified liver or spleen, simple draining or wounding, repetitive nosebleeds, minuscule red spots in your skin, petechiae, extreme perspiring, particularly around evening time, bone agony or delicacy. When to see a specialist. Cause a meeting with your primary care physician on the off chance that you have any industrious signs or manifestations that concern you. Leukemia indications are regularly dubious and not explicit. You may disregard early leukemia indications since they may take after manifestations of this season's virus and other normal diseases. At times leukemia is found during blood tests for some other condition. Causes. Researchers don't comprehend the specific reasons for leukemia. It appears to create from a blend of hereditary and natural components. How leukemia structures. When all is said and done, leukemia is thought to happen when some platelets get changes, transformations, in their hereditary material or DNA. A cell's DNA contains the guidelines that instruct a cell. Regularly, the DNA advises the cell to develop at a set rate and to pass on at a set time. In leukemia, the transformations advise the platelets to keep developing and isolating. At the point when this occurs, platelet creation gets wild. Over the long run, these strange cells can swarm out solid platelets in the bone marrow, prompting less sound white platelets, red platelets and platelets, causing the signs and side effects of leukemia. How leukemia is ordered. Specialists group leukemia dependent on its speed of movement and the kind of cells included. The main sort of characterization is by how quick the leukemia advances. Intense leukemia. In intense leukemia, the unusual platelets are juvenile platelets, impacts. They can't complete their ordinary capacities, and they duplicate quickly, so the infection deteriorates rapidly. Intense leukemia requires forceful, ideal therapy. Ongoing leukemia. There are numerous sorts of persistent leukemias. Some produce such a large number of cells and some reason too couple of cells to be created. Persistent leukemia includes more developed platelets. These platelets duplicate or amass all the more gradually and can work ordinarily for a while. A few types of persistent leukemia at first produce no early manifestations and can go undetected or undiscovered for quite a long time. The second kind of grouping is by sort of white platelet influenced. Lymphocytic leukemia. This kind of leukemia influences the lymphoid cells, lymphocytes, which structure lymphoid or lymphatic tissue. Lymphatic tissue makes up your resistant framework. Myelogenous, myelogenous, leukemia. This kind of leukemia influences the myeloid cells. Myeloid cells lead to red platelets, white platelets and platelet-delivering cells. Kinds of leukemia. The significant sorts of leukemia are intense lymphocytic leukemia, ALL. This is the most widely recognized kind of leukemia in little youngsters. ALL can likewise happen in grown-ups. Intense myelogenous leukemia, AML. AML is a typical kind of leukemia. It happens in youngsters and grown-ups. AML is the most widely recognized kind of intense leukemia in grown-ups. Persistent lymphocytic leukemia, CYA. With CYA, the most widely recognized persistent grown-up leukemia, You may feel good for quite a long time without requiring treatment. Persistent myelogenous leukemia, CML. This sort of leukemia mostly influences grown-ups. An individual with CML may have not many or no indications for quite a long time or years prior to entering a stage in which the leukemia cells develop all the more rapidly. Different sorts. Other, more extraordinary kinds of leukemia exist, including furry cell leukemia, myelodysplastic conditions and myeloproliferative problems. Hazard factors. Components that may expand your danger of fostering a few sorts of leukemia include past malignancy treatment. Individuals who've had particular kinds of chemotherapy and radiation treatment for different tumors have an expanded danger of fostering specific sorts of leukemia. Hereditary issues. Hereditary irregularities appear to assume a part in the improvement of leukemia. Certain hereditary issues, for example, Down condition, are related with an expanded danger of leukemia. Openness to specific synthetic substances. Openness to specific synthetics, like benzene, which is found in gas and is utilized by the substance business, is connected to an expanded danger of certain sorts of leukemia. Smoking. Smoking cigarettes builds the danger of intense myelogenous leukemia. Family background of leukemia. On the off chance that individuals from your family have been determined to have leukemia, your danger of the infection might be expanded. Notwithstanding, the vast majority with realized danger factors don't get leukemia. Also, numerous individuals with leukemia have none of these danger factors.